Therapists, you know how it is. We've all had those moments. You're in a therapy session with a client and they begin to share a story about sexual trauma. Suddenly your mind goes blank. You're trying to stay present, but part of you is shutting down. You can hear their words, but it's like a fog rolls in, and suddenly you feel de-skilled. Your mind starts racing with questions. What's happening in my body? Is this even true? What should I say? Do I need to report this? All of a sudden you think, I can't do this. Your body tenses, your thoughts scatter, and some part of you just can't wait for the session to be over. If you've ever felt that way, I want you to know you're not alone. I'm Laura Reagan. I've been working with survivors of sexual violence for over 20 years, even before I became a therapist when I was a hospital advocate at a sexual assault crisis center. Since then, I've supported thousands of survivors of sexual violence. I've managed sexual assault prevention and treatment programs, trained therapists around the country, and hosted conversations with the leading voices in trauma therapy on my podcast, Therapy Chat. Maybe most relevant, I'm a survivor myself, though for many years I didn't know it. It sounds so strange to say that today, but when I first began working in this field, I didn't identify as someone with trauma at all. But something in me quietly, persistently recognized the stories I was hearing. It wasn't until many years after I started doing my own healing work that I connected with what had been buried. And that's part of why I'm so passionate about helping therapists learn how to work with clients with sexual trauma and also do their own healing. Because when we do that inner work, when we tend to what's inside us, we show up more fully for the people we serve. Survivors of sexual trauma are hyper attuned to how present we are as therapists in our work with them. I know what it's like to feel overwhelmed by the pain of your clients, to be re-traumatized by the work, to carry the weight of it all and feel like you can't stop because if you pause, everything might fall apart. There was a time I questioned whether I was cut out for this work at all. I remember a moment early on when I worked with someone who had experienced a particularly violent incident. The injuries they had suffered were horrifying, and I was devastated. I didn't want to keep doing the work, but I also felt like I couldn't stop. Like I was the only one holding it all together, and if I took a break, everything would fall apart. The enormity of the trauma I was witnessing day in and day out completely overwhelmed me. I couldn't bring myself to practice any self-care. I didn't even think I deserved it. That inner voice that we therapists often hear started up. What was I thinking? I can't do this. Eventually, my supervisor had to step in and force me to take a week off. And I felt so much shame about that. She could see I was having a trauma response, but I couldn't see it myself. And then something shifted. It began with my own somatic therapy experience. Tuning into my body's wisdom gave me more capacity to sit with the difficult moments in therapy. And I learned what was missing in the therapy work that was preventing my clients from experiencing deep healing. As I incorporated these somatic approaches into my practice, everything changed. My sessions became easier. I stopped unconsciously avoiding topics. I felt more grounded, more confident, and more capable of co-regulating with my clients. Now I have the capacity to witness horrifying stories without feeling the need to turn away. I don't get triggered when my clients express their deepest pain. It also allowed me to help my clients heal places inside themselves that they hadn't touched in talk therapy. And I knew this is what we need to be teaching therapists. So I'd like to take a few minutes to walk you through a practice I might use in session with a sexual trauma survivor if I were to become triggered. I hope you'll find this helpful. So if you want to come along with me, I'm just going to invite you to begin to focus inward. I find it most helpful to close my eyes, but if you don't want to close your eyes, you can just lower them. Maybe place a hand somewhere on your body. So you're sitting with a client. You're noticing something's getting activated inside. You don't really know what's happening. So the first thing to do is just check your feet. Can you feel them? Are they touching the floor? or the surface under you. Whether you have your shoes on or not, can you feel the bottom of your feet? I like to stretch out my toes and really let them grip the bottom of my shoe or the surface I'm touching. Might want to pedal them a little bit or push them into the ground. Then you can invite yourself to notice what is happening on the backs of your legs. Do you feel anything there? Moving up your leg, going to the back of your thigh and the surface that you're seated on. It can be really helpful to engage your thigh muscles. So maybe you can't feel them, but if you allow them to engage, then you can feel them make connection with the chair or surface you're sitting on. From there, try to notice your sits bones. Right there between where your back of your thigh touches your bottom. If you can't feel them, you can maybe move side to side a little bit. You can do this in your chair while you're sitting with your client. Check your seat. Can you feel your bottom in the seat and the back of your body touching against the chair? If you're still not feeling grounded by this point, it's okay, but this is where it usually really kicks in for me. I begin to notice how much I'm collapsed in my body, start to lift myself out of my pelvic floor a bit, straighten my spine. Not tense, just coming up from the crown of my head. And checking my breath. Can I feel it going all the way down to the bottom of my belly? Pretty reliably, every time I check with my breath, it goes deeper. And then I do feel it all the way down to the bottom of my belly. If you still aren't feeling grounded, that's okay. But notice the back of your back touching the surface behind you. Maybe check what your shoulders are doing. Are they tense? Maybe you just want to move them around a little bit. So you might be noticing my body is demonstrating some cues of beginning to settle, swallowing, taking deeper breaths, slowing down. That's what happens. And that's all it takes to bring ourselves back into our bodies when we get activated. So I hope you'll find that practice useful. It's one of the many tools I teach therapists to use to help them in their work with sexual trauma survivors. They can use it for themselves and with clients. So sometimes when I find myself getting ungrounded in a session, I'll ask the client, are you noticing anything right now? They might be noticing that they're not feeling very grounded, and then we kind of do what I just showed you together. So there's a lot of different ways to do it. Sexual trauma is so pervasive in our culture, and yet we don't learn about how to treat it in grad school. And it does require specialized training to help therapists do the complex, intricate, important, life-saving work of healing sexual trauma. I've created a course with the Academy of Therapy Wisdom, and I'd love to invite you to join me. This course is grounded in everything I've learned and experienced as a clinician, an educator, an advocate, and a survivor. You'll learn practical tools to help your clients reconnect with their bodies, process what they've been through, and build safety in the therapy room, even when the material is complex, painful, or activating. You'll also learn to care for yourself so this work doesn't burn you out. No mistake, this is not about throwing away the modalities you already know. If you work with CBT, DBT, EMDR, IFS, psychodynamic work, or talk therapy, this course will enhance your work. to give you bottom-up strategies you can integrate into your approach. And if you're already a somatic therapist, this course will help you apply those skills to the delicate task of healing sexual trauma. Because working with sexual trauma requires deep attunement, an understanding of power dynamics, and a sensitivity to the body's relationship with safety, consent, boundaries, and shame. This course is about building that kind of attuned presence and the skills to help your clients with sexual trauma heal. Now, you may be thinking, I don't work with sexual trauma, but here's what we know. Sexual trauma is heartbreakingly common. There may be clients in your caseload right now who have yet to disclose or even recognize that they've experienced it. And all too often it goes unspoken, even after years of therapy. But according to the CDC, 50% of those identifying as female and nearly a third of those identifying as male have experienced some form of sexual violence. Many survivors say that they have spent 10, 15 years or more in therapy without anyone ever recognizing that what they experienced was trauma. And that oversight keeps people from healing. There is a place for talking, of course, but talk alone is not always enough. Sometimes it becomes a barrier, especially when the body holds what words can't express. And survivors of sexual trauma are often disconnected from their bodies. The wisdom of the body holds access to joy, empowerment, pleasure, and a felt sense of safety. If we don't support survivors in reconnecting body, mind, and spirit, we limit their ability to truly heal. And if we take a closer look at the culture we live in, one shaped by patriarchal values, rigid gender norms, and silence around sex and sexuality, it becomes clear that sexual violence impacts all of us in some way. Whether directly or indirectly, these dynamics show up in our clients' lives and our own. Many of us carry unconscious beliefs around sexuality, promiscuity, and shame that can interfere with our presence in the therapy room. To do this work well, we have to get honest with ourselves and unpack those messages. So if this resonates with you, if you want to feel more confident, grounded, and effective, I hope you'll join me in this course. You'll leave with tools you can use in your very next session and a deeper sense of your own capacity as a healer. Because when you do this work well, with presence, humility, and care, you're not just helping clients heal, you're helping shift the culture. You're helping break the cycle of violence. You're becoming the kind of therapist our clients need us to be. I hope to see you inside the course.